clerk will do that.
Did you want to swear an oath, or did you want to be affirmed? So the Bible's in front of you there. Thank you. Mr. Wharrie, do you solemnly swear that the evidence you shall give to this committee touching the subject of the present inquiry shall be the truth, the whole truth, and nothing but the truth, so help you God?
I do.
Thank you.
And you have up to 10 minutes for an opening statement, and then we'll go to questions.
All right.
Go ahead.
Good afternoon. My name is Derek Wharrie. I'm Wabusk Air's EMS manager. Wabusk Air is a standing agreement carrier and has been providing outstanding PCP service for the province in Orange since 2007. Paul Cox, the president of Wabusk Air, has been called out of the country on business and apologizes for an inability to be present. And that's all I have right now.
Very well. We'll go to the government. Mr. Morrill.
Thank you, Mr. Chair. Just confirming the first thing that you said, and I'm looking for the sheet that's going to tell me your name. I apologize.
Derek Wharrie.
Derek, thank you. There it is. Derek Warwick. Thank you, Derek. Did you say since 2007?
Wabusk Air, yes.
Okay. You've been with them since the beginning?
No, since 2008.
Okay. Where's that sheet with the names? So Mr. Cox has been the president since the inception of the organization?
Yes.
Okay. So clearly Wabusk Air has a history only under the regime of ORNGE and no experience as an air ambulance carrier prior to.
Correct.
Mr. Cox was not in the air ambulance business under some other incorporation or name, or this is 2007 he started? And
correct.
Okay. Where do you operate out of?
Moosonee, Ontario.
Moosonee. Okay. How many aircraft?
Presently we have one air ambulance aircraft. We're just in the process of getting a couple others.
So one fixed wing?
One fixed wing, yeah. One King Arrow.
Okay. Now the previous presenter, Ms. Vandertast, was responding to a couple of questions from Mr. Klees. And of course our rotation with Ms. Vandertast had been completed. And there are just a couple of pieces that I want to use you as my conduit. I apologize to get on the record. Not that there's any contradiction, but people following the proceedings might be left with an impression that we don't think was an accurate impression. And that is about, and I don't know what your experience has been. So you've been there since 2008. Mr. Cox's company started in 2007. Have you had, since 2009 or 10, any visits from the Ministry of Health?
Yes.
How many?
We just recently had one this summer, and then there was one in, I believe, 2010.
Announced or unannounced?
We had two announced and one unannounced.
Okay, so since 2010, so in 3 or 4 years, you've had 3 visits from the Ministry of Health?
Yes.
And one of those certainly was an unannounced visit?
Correct.
Okay. And the company this morning, Thunder Air, based out of Thunder Bay as well, indicated to us that they had an unannounced, at least one unannounced visit from the Ministry of Health. Now you were there, you started in 2008, so you were there for all 3 of these visits. Can you speak a little bit for us to what it is that the ministry does when they visit your operation?
I personally was only present for 2 of them. The unannounced visit I was not present for.
Okay.
But for the 2 that I did were the annual or the regular, excuse me, every 3 years they come in and audit us to renew our air ambulance license. So they come in and they take a look at our aircraft, the equipment we have on to make sure it abides by the ministry's minimum equipment lists. They go through our paperwork, our HR documentation, checking accreditation, that sort of thing, of all of our medics. They go through our supplies, our ACRs, which are the patient care records. They do various audits. They check our policies and procedures manual. They go through and do their own ACR audits as well, make sure that they're they're up to par with the ministry standards.
So it's a pretty exhaustive...
Oh yes, there's about 4 or so individuals that come up at a time, and it's spread over 2 days at least.
So 4 people show up at your operation. They're there for as long as 2 days on an unannounced visit.
On the unannounced visit, it was, from my understanding, it was only a few hours.
Okay.
Those were the announced visits for 2 days.
And you said you weren't there for the unannounced.
No.
Do you have any sense of what they do differently? If one is 2 days long and one is 3 hours?
The unannounced one, from what I understood, was just a quick check, just making sure our paramedics are carrying the proper credentials, like our OASIS cards, checking to see that our ambulance license certificate is present, and just a quick overview of our base, making sure that our hangar is up to par with the requirements of the ministry, etc. And I believe they're only there for maybe an hour or so.
Okay. Are you involved in the actual RFP process on behalf of the company at all?
Part of it, yes, on the EMS side.
Can you tell me a bit about what?
So I do participate in the drawing of the RFP response. So anything to do with the paramedics, the EMS equipment, that sort of thing is comes under my domain.
So you would be providing assistance to your president, Mr. Cox, in terms of his ability to fill out the RFP, to submit a bid, to get work through Orange?
Yes.
Okay. This is the reason I'm asking you that is that Mr. Klees asked a question to the previous presenter, and I think it's a fair question. And I'm not sure it's something you can help us with, because it was about the most recent RFP that was put out, or the last two, I don't recall if it was the last two, about the financial data that was no longer contained within the RFP, that would speak to the ability of a proponent to be able to carry on as an ongoing concern as a business operation and make sure they could fulfill the obligations that they were bidding for. And yet, and I don't know if you can speak to this, the chances are you can't, and yet from the Auditor General's recommendations, after the audit of Orange Air Ambulance and related services, he provided us with 5 recommendations. And he's the Auditor General. He's an independent officer of the legislature. He does not work for the government. He works for the legislature. And his recommendations don't speak to that. Okay. And I'm just curious, as someone who, and it's a bit unfair, if you can't tell me, you can't tell me, because you're on the EMS side, more on a services side, but I'm just curious if you have any sense of why, and given the recent history of your company, perhaps you don't go back far enough. But do you have any thoughts on that?
I am familiar with that Schedule A that you're referring to.
Okay.
I know that Paul and I have, Mr. Cox we had discussed it because it had been there previously, and I'd seen it in the response and so on.
Right.
And we had discussed how it's not there anymore.
Right.
And we chalked it up to maybe because of our experience with Orange. We're not sure. We weren't sure.
It's kind of where I was going, if that's a possibility. I mean, I have no way of knowing if that's the case or not, or how real relevant it is. But I do think there is some relevance to the fact that an auditor, the Auditor General, working independently for the legislature, in his recommendations didn't speak to that piece, and it used to be there and it's not there anymore. So anyway, we'll see. I'm sure Mr. Klees may have a question or two about that as well as we go forward, but I think there's some relevance to that, and I'm interested if there may be some explanation as to why that is no longer contained.
There was never an explanation given to us.
No, understood, but I'm just hoping that at some point maybe us as a committee will be able to understand why they felt that was no longer necessary. Do you receive in Moosonee, and that's your only base?
At this time, yes.
Okay. Do you receive a guaranteed number of hours of work or a minimum revenue stream?
Yes.
Okay. When did that begin for your company? You started in 2008?
Yeah, so that happened in the last contract.
The last contract came out in 2012?
It's kind of confusing because there's a lot of delays and whatnot.
Okay.
So I would say maybe 2010, around there.
So it was a new piece in 2010 where they began to supply carriers with a guaranteed base income, and to me that makes complete sense, and would be entirely necessary to get people to be interested in being part of this process. Would you have been able to participate in this tender without this guarantee?
The financial aspect of it isn't really under my realm.
Yeah. Well, maybe if I go at it a little bit of a different way, does Wabusk Air, as in its business model, what percentage of your work is air ambulance?
I can't give you a definitive answer on that. I know that we have one aircraft that is pretty much every day working for Orange.
Okay.
So I'd say that one aircraft is running probably 80 to 90% for Orange, and then our other aircraft are completely other revenue streams.
So you have more than one aircraft?
Absolutely.
I see. And one is dedicated to Orange?
One is dedicated to Orange. We're looking at bringing on a second.
Okay, so you're a pretty diverse company then.
Yes.
Okay, that's kind of what I'm going at. So with or without the guaranteed income, it's quite possible you as a company would have been able to bid on this work,
yes.
And it's perhaps less important to your company than it might be to others.
I suppose.
Okay.
Again, that's not really under my...
Fair enough. Yeah. Tell me a bit about the geography that you serve.
Generally speaking, we cover the sort of eastern Ontario, the northern coast of James Bay. We've, on time to time, we'll go as far west as Hamilton, London. We've been across the province, but our general area that we cover is probably from Sudbury down to Kingston, Toronto, and north up to Peel-Onic.
It's interesting. So based in Moosonee, you would provide flights as far away as Hamilton.
Yes.
And so that would obviously be a situation where a patient from Moosonee needed to go to Hamilton?
Generally, in that aspect, it's something like we've gone from Moosonee to, say, Kingston.
Yeah.
There's an agreement with the two hospitals there, so most of the Moosonee patients, when they need to go south, go to Kingston.
Yes.
And then once we're down south, then we'll, through...
you might, just to make the circle, you might do some work and...
go to Toronto, pick up, go to Hamilton or London or Pembroke, Ottawa area.
Gotcha.
Something like that.
Yeah, while you're there, why fly empty?
Exactly.
Maybe there's a way to utilize you and be more efficient with your...
They try and keep us full as much as possible.
Makes complete sense.
Yes.
Yeah, because people listening to this might wonder, well, what's this guy from Moosonee doing in Hamilton, picking up somebody if... Yeah. Right, so it's important that we wanted to make that part of the record. So is it from a care perspective, and you're the paramedic, so this is more in your area of expertise. What can you tell us? What's your opinion on how Orange is doing in terms of providing a good level of care for the people that we are responsible for serving?
Well, Orange's medics, up to the level of critical care is second to none, really. I think right now they're struggling with staffing and having enough people at those levels, that level of care. So education and whatnot, I think is struggling a little bit. The underlying reasons for that, whether it be budgeting or resources or something, I can't comment on. I don't know the reasons for that.
Is your operation that I hear you said very little at the beginning, but are you advanced care?
We're primary care, and we've just actually, in this contract, been awarded the ability to go advanced care.
Okay, because it's important for me to know as well, because and I asked this question from of the previous presenter as well, because this morning's presenter, I took away from that presentation that people would be being serviced who might need an advanced care paramedic, and they weren't getting it, but it doesn't sound like that's the case. It sounds like individual providers through the SA agreements have bid as to what level of service they would provide, and that when you got a call for service, they would tell you if we needed primary care only or advanced care. Have I got that right?
Sort of.
Okay.
How it goes is that the OCC, they know each carrier's level of care.
Yeah.
So they know which level of care is on every aircraft, whether it be Orange, Wabusk, Thunder, any of the SAs.
Yeah.
So we would only be dispatched to the level of care on
Correct.
that aircraft.
Exactly. But that's making my point, I think.
Okay.
So if the level of care required is an advanced care, they're going to dispatch an advanced care aircraft with
if available. And
if
then
available.
If not available,
Yep.
then they'll look at whether or not they can get a nurse or a doctor to go,
Yeah.
depending on the
Sure.
triage of that patient.
Absolutely.
Yes.
Absolutely. Okay. That's understood. We'll keep a bit of time in reserve, Mr. Chair.
Very well. Move on to the opposition. Mr. Klees.
Thank you. I just want to follow up on the clarification and clarify the clarification with regards to these ministry inspections.
Okay.
I believe you said the last ministry inspection you had was this year. Can you tell me the date?
It was this summer, I believe in July.
And that would have been the inspection that the ministry does following the approval of a contract, which was your most recent one, which closed March 13th. In other words, it was effective March 13th, so that Ministry of Health inspection would have been part of that inspection that they do once a contract has been approved.
I don't believe the two are joined.
When was the previous one?
3 years prior, in 2010. So every 3 years, once a service applies for the ambulance, an ambulance license, every 3 years it's automatic whether or not there's a contract or
That's
not.
my point. No. The last contract that you got,
Yes.
the RFP was dated September 13th of 2011.
Right.
The effective date of that was January 2012.
Right.
Okay?
Okay.
The last RFP was dated December 4th, 12th, and was effective March 13th.
Okay.
For clarification of the clarification, the Ministry of Health does an inspection once every 3 years.
Correct.
You have not had an inspection more than that,
Correct. Well, other than
other than the 1 hour
that's right.
when they came along and asked for your... Well, no, he said 3 hours initially, and then he clarified it to say it was an hour. The point was that I think we've established the fact that once every 3 years is not nearly enough for the Ministry of Health to do its due diligence and to do what should be done to ensure that these carriers are in compliance.
Okay.
I want to... I asked the other witnesses about their compliance with one of the contractual obligations of the RFP, and that is with regard to the collision avoidance system that was required to be in your aircraft since 2008. Did you comply with that requirement? Does your King Air have the collision avoidance system as prescribed in the RFP?
I can't comment 100% on that, as I just deal with the EMS side of things. But as far as I understand, I've been told that our aircraft are up to par.
The information that I have is that your aircraft has a PCAS system,
Okay.
which is totally different. And here's the difference.
Okay.
The TAS system has a cost of about $70,000 per aircraft. The PCAS system, as I understand it, can be bought for $1,000.
Okay.
You say that's okay?
Well, okay as in I understand what you're saying. I don't know if that's the case. As I said, I don't have anything to do with the aircraft physically. I know that one of our aircraft is going down for refit. For what the details of that, I don't know. That would be something that Paul would have to comment on.
And I also understand that the PCAS does not work in the north.
I can't comment on that.
Certainly wouldn't be very helpful.
I'm sorry.
It's not helpful that the owner of this business is not here. This is not a regular occasion for this committee. I don't know what his business is down in the United States, but this is pretty important business. And I just want to send a message through you that I am most disappointed, because we're dealing with very important issues here. There are only 5 of you who are providing this essential service to the province of Ontario. And I would have thought that this would be a priority for him. I have no further questions because I don't believe this witness can, quite frankly, answer the questions that I have. And I would ask that we issue another request with the cooperation of the committee to the owner of this operation to appear before us.
Very well. We'll move on to the NDP. And who would like to go? Ms. Jelimus.
Welcome to Queen's Park,
Thank you.
thank you for coming all the way down. I know that it's not easy to go from, I take it you're based out of Moosonee?
Yes.
Yeah, Moosonee, Queen's Park. There's no direct flight, no subway, no GO, no nothing. I know the work involved to come down here, and I thank you for your effort. I take it that you are on the front line of providing emergency medical services, and I would like to gain from your expertise on a number of issues. The first one I would like to talk to you has to do with the past. You have been in the north for a number of years, and I'd like your impression as to how would you rate our air ambulance service right now? Are we doing a good job? Are we not meeting your expectation or expectations of the patients? How would you rate us?
From an aspect from Wabusk Air, we've gotten busier over the years. Whenever the need for the higher level of care, the aircraft come across the province to meet the needs of the patient. So from the aspect that we can tell, the patients are getting met and are being transported as required. Under what timelines, I can't comment on that. There's always rumors of aircraft not being fully staffed and so on. But again, these are things that I don't have proof of. So, but for the most part, I would say that from what I've heard and what our experience is that the patients do get the service that they need. Sometimes it's just a question of timing, but there's a lot of things that come into play, whether it be weather, resources, etc.
I live in the north, so do you have confidence that if you or one of your loved ones needed ambulance services, that we would deliver?
Yeah, I'd say so.
You're confident?
Yeah.
Yeah, me too. The other questions I wanted to ask you has to do with the type of patients that you are transporting, and if you have seen any trends or changes in the type of calls that you get, the type of patients that you're asked to work with. Has there been significant changes, either in the recent past or distant past, or do you see trends for the future?
I'd say generally the majority of the patients we receive, as we're primary care primarily, is so low acuity patients returning from different procedures, various appointments from the north, things like of that nature. In the last probably few years, we've been getting dispatched more and more higher acuity calls up the coast mostly. So a little more sicker patients Whether that's just due to resources, etc., I'm not sure. They seem to be utilizing our service more effectively, and more frequently. So, and then in the future, as I mentioned before, we've been finally approved to provide advanced care as well. So we are hoping to, in the future, to provide not only primary care but also advanced care service to the north. So that would increase the level of care available to the people of the north.
Just on that quick point about advanced care, how do you find the training, the accessibility of training? Like, how easy is it to actually get trained up from whatever level of critical care to advanced care?
Extremely difficult, actually, unfortunately. There's two parts to becoming an advanced care flight paramedic. The first part of it, becoming advanced care land, is very easy. Colleges generally anywhere in the province can offer that, or there's a number of colleges. The difficulty comes to bridging to advanced care flight, and that unfortunately is only through ORNGE. And we've asked for details on upcoming courses and availability to train some of our staff to be able to provide that advanced care. And unfortunately, to this date, they haven't been able to provide any dates.
And just a quick comment, do you think that allowing or making an accommodation for advanced care and also critical care training in colleges might be a solution to provide more ways for people to get trained?
I guess ideally it would alleviate, just having one person provided that monopoly. Unfortunately, the business case for that, because it's such a minute number, that once this mass amount of people, whether they work for ORNGE or an SA Care, get trained up, it would be very few people in the future, right?
I see.
So, it would be a great solution to the problem right now, but going forward, I'm not sure that from a business case for the colleges it would make sense.
Okay, so just one more on this one. So right now, if we look, like the college in North Bay does aviation training, the medical part of the advanced paramedic is given in our college. Would that make it easier if it was available at Northern College or if it was available at Cambrian? Or
that's not the issue. The issue is bridging over to the
Federation, sure.
Yeah, bridging over to the flight side of things.
Yeah, but I mean, if those colleges that already teach flight, that already have those kind of courses, not for paramedics, would offer the flight part of the advance.
Like aviation as in like pilot training?
Yeah.
Is that what you mean?
Yeah.
Well, the two are totally different,
Yeah,
so
okay.
I don't see the connection. Like the connection there, I don't think would be there. You would have to look at the colleges that provide primary care and advanced care, like Fanshawe, sort of thing. In Niagara, different colleges like that, Durham, and whether or not they would be willing to take on the air component. But right now, the air component is only provided by ORNGE.
Okay. All right. So you've talked about some of the services that existed in the past. I don't know if you'll be able to answer this, but I'll ask it anyway. Does the fact that telemedicine has been rolled out to most of the nursing stations, to most of the fly-in only First Nations community, does that help, in a sense, bring the level of acuity up? Because now, in theory, the follow-up to surgery should be done through our telemedicine system, which means that they don't have to fly no more. Have we had an effect through this way, or am I putting two and two together that don't belong?
In theory, it would. I've seen and I've heard cases where, as a service, we've asked ourselves, why are we transporting this patient when theoretically we know that there's a telehealth system set up in that community. Whether or not I can't comment on why we're still doing that transfer, if the diagnostics needed aren't available there or whatnot. So I would say that I'd imagine it helps on sometimes, and other times it still requires transport out.
Okay.
So I wouldn't say it's eliminating all transfers for follow-up.
Okay. I'm bringing you back into the past again. You knew of Orange. Did you know Dr. Mazza?
Yes.
And did you know that there was something wrong going on at Orange before it hit the front page of the papers?
Just through rumors. Like, I didn't personally know Dr. Mazza. Just the rumor mill, really. We saw the kind of money and how quickly it was being spent, and the drastic changes in the industry. So obviously that was a little concerning. So that sort of thing we saw. We didn't. Well, I guess that is cause for concern, absolutely.
So when you talked about through the rumor mills, what were you hearing at the time?
We were hearing these conceptual ideas of going international, of potentially taking over all advanced care from all SA carriers, and that Orange was eventually going to even allegedly push out all primary cares, and they wanted the whole pie, if you will. So these are the rumors we have heard.
Right? Enough for the past. We're into the future now.
Yep.
If you could have your own way, how would you improve the air ambulance services in Ontario?
Well, I would say that the SA carriers are an essential part of it. When the province needs the transport of patients, we're there to provide it, and then when we're not flying, we're not getting paid. So we're not sitting around doing nothing, getting paid for that. Not saying that the dedicated carriers of Orange aren't required. By all means, you need a level of care that there's somebody at a drop of a hat. You absolutely need that. And then you need the carriers, the SA carriers, for the overflow of that. I would say the best way to go forward would be to allow the SA carriers to increase their level of care where needed, so that they're able to provide primary and advanced, and to ideally allow the training up of those individuals to be a little more easy.
All right, so your view of a better system is, I don't want to put word in your mouth, but I want to make sure I understood. So your view of a better system is a system quite similar to what we have now, except that the SA carrier not only do primary care, do advanced. Do you see it doing critical as well, or?
Critical has never really been in the scope of a SA carrier that it hasn't been dedicated to the system. You have issues on getting the experience to keep those skills up, because they are quite diverse.
Mm-hmm.
So I can't really comment on that. There's been talk and rumors of maybe getting rid of the advanced care flight portion, because the gap between advanced care and critical care is very narrow, and every day it gets narrower, whereas the jump from primary care to advanced is huge.
Okay.
So it could be a restructuring of the whole system where you get rid of the advanced care completely and only have critical care in the air, and then some kind of portion of just regular transfers for primary or advanced cares, just regular advanced cares and not flight.
Oh, rather interesting. So the system sort of stays the same. Orange continues to operate mainly on the critical care side. The SA contract do the primary care, which gets merged more or less with more advanced. And then you make sure that there is enough training so that people who want to recruit have a pool of qualified people to select from.
Yeah.
And you feel that this would improve our system, and this would bring us to a very good system?
Yeah, essentially, yeah. Basically, you need dedicated carriers, whether it be Orange or somebody running it elsewhere, like it used to be, where you have, somebody on call ready to go at a drop of a hat. You need that aspect of it, hands down, and then you need the ability for the overflow, and then we just have to sort out the level of care issues. And because you have BLS transfers that are going to always have to be made, So do you need critical care for those? Not necessarily. So we gotta figure out what the ideal situation is, whether it is getting rid of advanced care and just having critical care and primary care, or some kind of derivative. I'm not sure.
All right. My next question has nothing to do with what we've talked about. It brings you to the present. The ministry has made significant changes. You can probably know that there's a new board, there's a new CEO, there's new directors, there's lots of changes that have happened at Orange. But let's say something was to go bad. Let's say the rumor mills that fed you that information that something was drastically wrong at Orange started again. There's something drastically wrong happening at Orange. Who would you tell, and how would you go about telling that person?
It's hard to say right now, because right now with Orange sort of having the full control of our contract, you don't want to really disturb those waters, if you will. In the past with the Ministry of Health, on inspections we've asked questions. I know I've asked questions on why are certain things happening differently for Orange and whatnot, and
That's when EMS comes and government EMS comes and do. Okay.
There's been a history of certain things that we've had to do, and Orange hasn't done it in respects to like ACR audits and whatnot, things like that. But we've never had any answers, and I'm not sure that the frontline staff would have those type of answers.
No, me
so,
neither.
and I don't blame them for that. But at this time, I don't know where the avenue would be, or how it would look like.
Let me throw something at you. Have you ever heard about the Ombudsman?
Sorry?
Ombudsman of Ontario?
I've heard of them.
Okay. And would you know how to reach the Ombudsman if you needed to?
No.
No?
Not personally, no.
No.
Something I could look up.
The internet works in Moosonee most of the time.
Yeah.
When I ask you what would make our system better, you did not talk about the oversight, where some of the oversight in the contract right now is not being done. I don't want you really focused on two things, the training and the dispatching of the level of care. Is it, I'll leave it out there, it's not critical to improve in your view?
I guess from my perspective, I'm more frontline. But looking back, I would say absolutely the oversight definitely is needed. Orange needs to be sought over just as much as all of us SA carriers, and should be held at the same standards. So it would be important to have a process because we have penalties that we can get if we don't react in certain amounts of time, or we don't tell them where our aircraft are effectively, or something like that. So we have penalties, but Orange unfortunately doesn't have any penalties like they used to. Not Orange, but the air ambulance system used to have checks and balances, and from my understanding it doesn't any longer.
So Orange right now, do they actually carry through on those penalties? Do you ever remember a time where you were charged a penalty because your aircraft was down, because you didn't report?
No.
No?
No.
Okay. So they're there, they bark but they don't bite?
Well, I'd like to say that we've never had to put in that position.
Better answer. Way better answer.
Yes, but they are there. I don't know of any instances where any of the carriers had to have been held up to those. It would be between Orange and those carriers, but we've never been in that position, nor have we needed to be, so, or should have been, I should say.
Okay, we'll let it go around.
Very well. We'll go to the government. Ms. Jasic.
Thank you. Mr. Warwick, you explained to us that you joined Wabusk Air in 2008. Where were you working before that?
I was working in confined space rescue. I changed in career, so I went back to school, got my paramedic qualifications, And then I started right into with Wabusk as the EMS manager, and then as a flight paramedic as well.
So you're trained to the level of a flight paramedic with basic primary care.
I'm also employed by Orange, and I've just completed my advanced care didactics. So right now I'm working through my preceptorship for advanced care flight.
Okay.
So I'm a resident.
Okay. Now, you've explained that Wabusk Air is looking to dedicating another aircraft to air ambulance work and staffing up to the advanced care level. So is this something that you're going to be taking on, or will you be hiring additional paramedic coverage?
Ideally, well, it wouldn't be something that just myself could do. The plan is to hire other advanced care paramedics and to train some of our primary cares up to advanced care, and sort of keep funneling up as, from within.
So, in essence, your business is expanding.
Yes.
Yeah. Now, in response to my colleague, Ms. Jelina, you said, in your view, overall, it would be preferable to increase the scope or the capacity on the standing offer side, and in essence keeping the Orange capacity for the critical care, the on-scene emergency type response.
Some kind of organization to do that, absolutely.
Okay. So you also said that because of the issue of that your contract is with Orange, that perhaps you don't want to necessarily rock the boat, or if there's something going wrong, that there's an issue there because the whole, who would you complain to, or you might get into trouble. So if you see that you get more of the private sector involved in the basic interfacility transport type of situation, how would you envisage, what would you see as a model of how, when things might go wrong, who would you think you could appeal to, or what would you like to see as some sort of protection?
I guess it would have to be like an anonymous ability to come forth to a governing or an oversight committee of Orange to fulfill or to look at any issues we might come up with that we don't feel comfortable going directly to Orange, or them having the ability to fix or willingness to talk.
So are you aware that Bill 11, which is in front of the House, our government bill actually provides exactly that kind of whistleblower protection? It is to go, in fact, to a legal firm if there is a complaint, and it's investigated, and that is independent of Orange?
I've heard of it, yes.
Yes. Okay, so you would agree that that would be potentially a good solution?
So, yes.
Yeah. Okay, on a day-to-day basis, you communicating with Orange. You did before, from 2008. Can you just explain to us how you feel the relationship with dispatch, with anyone you might need to talk to at Orange? Is there any difference pre the new management? Can you explain to us?
From the frontline aspect of it, talking with the OCC on a daily basis, no. There hasn't been much of a change at all, I would say, from our side of things. From a managerial point of view, the time frames for looking for clarification or any information, I would say, are the same, if not maybe a little longer at this time, just with everything, with all the changes and who do we talk to and sort of thing, that sort of thing.
Mm-hmm.
But for the most part, I would say, from an SA carrier point, there isn't that much of a difference.
So in essence, patients are being looked after. You don't see any deterioration in service or anything of that type?
In our neck of the woods, in our little box, because we don't know the big picture, right? You get the patients or the facilities to say, what took you so long? But then you also get the other ones like, wow, that was quick, right? So, it's hard to say from a global aspect, because, we just get told what to do specifically in wherever the area we are at the time. So we don't know how long this call's come in, how long they've been sitting on it, or anything like that. So from our aspect, I would say, the patients are getting where they need to be. Do you hear about things? Absolutely. But nothing in our sort of world do I see any immediate shortcomings.
You've used your time up.
That's right.
You satisfied then?
Yes.
Okay, and Mr. Klees, okay, Ms. Jelinek?
Been a really bad time. Here again, thank you for coming. I just want to make the most out of the time that you will spend with us. You have on-the-ground experience. I've asked you, how do we improve the system globally? If you look at the work that you do on a day-to-day, what would make your work better for the patient and better for you?
That's a tough one. As a frontline medic with an SA carrier, it would probably be some increase on communication. We have a lot of offload delays at various hospitals. Whether or not that's because of local EMS or et cetera, we don't have that big picture. So there's often some, we have to chase OCC rather than them providing us proactively. So maybe I would say that.
Some of the cities or hospital comes to mind when you talk about offload delays?
Absolutely.
Which one?
Kingston, Sudbury, Thunder Bay.
Is one worse than the other?
I would say Kingston and Sudbury are probably pretty close as being the worst that we endure on a weekly, sometimes daily basis.
On a daily basis, so it's not a one-off, there was
No.
a huge accident on the...
No.
It's more of a systemic problem.
Yes.
Anything else you can think of that would make your work and the quality of patient care better?
The ability, as I said, to make things easier to go advanced care and to be able to provide that care. There are times up the coast that, the patients could use advanced care, and sometimes with us being right there in Moosonee, there's delays waiting for aircraft coming in from other, Thunder Bay, let's say, or whatnot. So, us being able to go advanced care and having the staff and the training would definitely assist the communities.
In making it better and safer for all?
Absolutely.
For all. So this issue of getting the training for advanced care is something that comes up over and over when we're looking at improving the quality of the service. Mm-hmm. What can we put into place that would make it safe for you to report something if you saw that something was wrong?
I guess the ability to report anonymously, for one, and then having the committee or whoever we report to have the power to invoke action.
Otherwise, if you're reporting to somebody who cannot act, then it's...
Yeah. It's kind of, if it falls on deaf ears, it does nobody good, right?
So if you were able to report anonymously, you feel that that would be a good way, and if you knew that when reports were done, they were actually follow up?
Yeah, so we'd have to have, it's a two-way communication required, right? Like previously, concerns have been brought to our contacts on a sort of a mid-managerial level, but the question is whether or not it goes up to the top or wherever it needs to go to invoke the action, right? Nothing appears to happen, so you have to feel that it didn't go where it should be, or it fell on deaf ears and they don't care what we have to say.
Neither one of those are really good.
Exactly.
So we're looking at what could be improved. If you look at the different bases that you service, as in that you get patients from, not repatriation, but really pick up patients from, are there some of those is there a community or a nursing station or a hospital that you service where you get more complaints than others, as in they are not as well serviced as another one, or things are not working out?
Historically, like Saskatchewan and Fort Albany have had smaller communities, but they have recently, James Bay Ambulance has been able to expand into those communities. So I think that has alleviated a lot of the problems. They've got the nursing stations there. So overall, I wouldn't say anybody really sticks out in my mind as always, why aren't we getting the service or anything like that.
Do you ever end up bringing a nurse back with you because the level of care is past primary care?
Yes.
And how does that work out?
It's difficult because at the same time, the nurse technically has control and care of that patient. I don't think there's a complete understanding of what their responsibilities are on the flight. So a lot of times our primary care paramedics are monitoring the patient more than what they should. And then if, heaven forbid, like anything happens, whether or not, it's not an ideal situation, right? That nurse is out of their element. If something happens, they can't do that very much without a doctor's order. Like obviously our paramedics can provide life-saving measures, CPR, defibrillation, that sort of thing, right? But if certain medications are required, we don't have that ability, right? And it's not like you can just pull over in the sky and get that assistance. So is it ideal situation? No. But does it, is it effective when it's used? It's one way to get the patient moved. And at this time, it's the only way.
Okay.
And are you almost done?
A one-off question. Do you have large amount of time where your aircraft radios you broadcast to traffic where there's nobody to talk to?
We, like with the ATC, you mean?
Mm-hmm.
Air traffic control, we can always contact them.
Okay.
Wherever we are, all the way up the coast. We don't have contact with the land CACs, the dispatch center in Timmins, once we go north of Moosonee. But we have the sat phones for dealing with calling with Moosonee, Orange, or the ability to communicate through, I don't know how they do it, through the ATC to get messages to Orange or a local dispatch center if we need to.
Okay, thank you.
Thank you very much, and thank you for coming before the committee today. Appreciate it. So at this point, we're going to go into closed session to discuss documents and a couple other issues.